It's time for us to start our meeting, and we've also formed a quorum. So please invite the government representatives and the deputations to come in.
因為咧，我哋呢個次序係跟佢入嗰個，即係話入翻嚟嗰個時序排嘅啫。因為佢坐輪椅，所以就將佢排咗喺度。明白。係啦，咁所以你到時你睇下你中意點樣排，即係你跟呢個次序，有啲咁樣排嘅話，跟翻呢個時序啊，由得你，因為跳嚟跳去嘅。明白。係啦，因為呢幾位都係坐輪椅，所以將佢編喺最後。明白。咁樣可能，跳到好緊要喎。係啊，即係狗咁樣你一跳喺呢度，即係如果你想跟翻佢嘅時序就講俾佢講，但係如果你即係覺得好咁，你可能就咁跟，咁就變咗有啲會早咗，有啲遲咗咯。即係但係佢哋就唔知佢哋嘅時序，我哋收翻佢個條。明白。將晒睇一睇佢哋係啦，即係話嗰個不受保護嗰樣嘢。我哋係啦，應該唔係呢個嘅，應該OK， 唔該晒，係啦。好。應該請咗政府介紹啲文件，然之後先至講。好。
好，各位同事，我哋
Colleagues, today's meeting is on planning for the provision of home care and community care services for people with disabilities and quality of such services. Such services are very important in order to avoid institutionalization as far as possible, such that PWDs can have choices, live in dignity, and remain independent. At present, we don't have enough services, and quality of service is also a concern. So I'd like to invite the administration to really very briefly introduce the paper to us, and then we'll proceed to the 27 deputations and individuals. Mr. Siu, Commissioner. Yes, thank you, Mr. Chairman. I won't repeat the content of the paper. On the paper, I'd like to highlight and emphasize a few points. First of all, I very much agree with the Chairman that the objective of the rehabilitation policy is to provide suitable care and community support to persons with disabilities such that they can still live in the community. We'll also have a balanced development for residential care. Some PWDs may not be able to live independently, or family members are unable to provide them with sufficient support and care, and they can still resort to residential care. So daycare and community support services as well as residential care services are developed in a balanced manner. On the mode of service and breadth and depth of services, we've all along been seeking improvement. Let me cite some simple examples. For persons with serious disabilities, we've started home care services. In the policy address and the budget, it is mentioned that we have a pilot project which will be extended to all the 18 districts of Hong Kong. And this pilot scheme on home care services for persons with severe disabilities will be further extended to cover all PWDs. And in this paper, you can see that we have absorbed views expressed by electrical members and community organizations in the past. And our services are district-based and carried out in all 18 districts. Members' views are very important. Before I came to this meeting, I received some written views. And in a moment, we're going to listen to verbal views. And from the submissions, we can see that there are specific, detailed, and pragmatic recommendations. Here, we'd like to thank the deputations. They're very helpful in our future direction of development, and will continue to take on board their views in order to improve the quality and quantity of our services. Thank you, Commissioner. Now I'll open the floor to the deputations, giving them 3 minutes each. We only have 2 hours, so I really want you to grasp your 3 minutes well. I'd like to remind you that you are not protected by the Electoral Powers and Privileges Ordinance. So first deputation, Amity Mutual Support Society. Mr. Chan Kwok-man. Mr. Chan, you can start. Mr. Chan, do you need some time to prepare yourself? Mr. Chan, if I come back to you later, would it be all right? So we'll invite Ms. Kwan Choi Ping from Tung Group of Hospitals. Good morning, members. Tung Group of Hospitals also operate a district support center in Lok Kwan. It's a bit regrettable that up to this moment we've not got a permanent premises, so we would like to have a permanent premises as soon as possible. Given our experience in the past 4 years, for district support, if we don't have a permanent premises, it's very difficult. In fact, all parties concerned are working very hard. In that regard, we would like to make progress as soon as possible. I'd like to share with you my experience in my district support services. There must be sufficient flexibility in the provision of services. Now we're resorting to figures in the counting of service hours, number of activities, etc. In fact, that's not a good standard for assessing district support. Quality is very important. Our service targets need substantial services and support physically and mentally. Their family members also need support. For persons with severe disabilities, we have to spend more effort in working out how to assist our service users. So that's my sharing. Thank you, Ms. Fan. Next, from the DAB, Ms. Chang Fan Lan. Thank you, Chairman. In terms of support for PWDs, with certain proposals, there must be barrier-free accesses such that PWDs can, like ordinary persons, freely go in and out of venues and premises. There should be enhanced community facilities, and street facilities should also support PWDs. And we would also like to have funding support so as to improve the entrances of buildings. Rehabilitation vehicles and non-emergency ambulance services should also be enhanced to facilitate PWDs in booking such vehicles when they want to, for example, attend clinics. And for the carers, subsidies should be provided. Under the concessionary schemes of franchised buses, PWDs already enjoy concessions. Such concessions, if extended to carers, would be very helpful. Besides, most rehab buses run in the urban areas. If they can also service rural areas and remote areas, it would be better. As for carers, if possible, be listed out in a list. And for the chronically ill and their carers, there should be tax concession and monthly subsidies, like $1,000 per month. For the integrated community centers for mental wellness, there should be enhanced support. At the moment, the center is serving those who are willing to come forward to receive services. For the hidden patients, more services should be provided to take care of their health conditions. We would also like to have a 5-year plan. PWDs may have been applying for residential care for a long time, just like the elderly, so we would like to have a time frame. Thank you. Let us go back to Mr. Chan Kwok-man from Amity Mutual Support Society. Sorry, Mr. Chairman, just now I did not hear you clearly. Please start. There are not that many rehab buses in the new territories. So sometimes it's not very convenient to take the rehab bus to attend meetings in the urban areas. Thank you very much. Next, from the Civic Party, Mr. Elvin Young. Thank you, Mr. Chairman. The Civic Party has sent you a written submission. Today, I just want to share with you some salient points. Today, we're talking about the daycare and community support services for PWDs. When we talk about community care, we have to take care of their jobs. We should consider their self-reliance ability and whether sufficient support have been given to them. According to the Census and Statistics Department in 2008, we had 360,000, that is 5% of our population of PWDs. would look at the workers, the number of workers amongst PWDs. According to the Commission on Poverty, 45,800 are engaged in employment and 41,000 are employed. About 13% of the overall PWD population. Is that sufficient? Obviously, comparing those figures with the average figures of Hong Kong, our services have not been adequate. Now, look at the figures. Up to March 2012, how many PWD civil servants were there? 3,391. 2% of the overall civil service. Now, that had not changed for many, many years. Is it really true that the government would like to take the lead to assist PWDs in their employment? If we only offer them subsidy and help and do not tackle the problem at source, that is to assist them in employment, then it's not genuine care according to the standard of the 21st century.
I hope the government can consider this point. That is, the government should take the lead or set up a target goal. That is, a certain number of PWDs should be employed. And now a lot of jobs are outsourced. So for this outsourcing contracts can a condition be included. That is, part of the jobs should be reserved for PWDs. If this can be done, I'm sure it will be very encouraging for PWDs in Hong Kong. And I have also submitted a submission, so I am going to end here. Next, the Parents Association of Preschool Handicapped Children, Ms. Chang Kwok Chun. Thank you, Chairman. What I want to talk about today is mainly about 3 points. First, respite service. Second, the shortage or the lack of adult service. And third, district support center. As for residential respite service, I think it started in 2008. And I'm surprised to find that this respite service is just a temporary service. It's not permanent. Well, in 2008, we were not told that this was just a temporary service. Now, for residential respite service, it's very important for carers. Now, because if there are problems in the family or the carer falls ill, then the PWD would have to be taken care of by somebody else. I remember many years ago, I was hospitalized. I had to go to the hospital in the middle of the night, and I didn't know whom I should entrust my son with. And the next day, I had to tell the doctor that after taking tests on me, you have to discharge me from the hospital because I have to take care of my son. Now you want the PWDs to live in the community, but what you are doing is against this direction. You do not provide us with enough support. So how can we live comfortably in the community? And the second point is about living in the community. It's about daytime care for adults. In particular, in the North District, in Yuen Long and Tai Po, although we have started waiting since 2006, and up to now we still cannot receive such a service. And in Tuen Mun, there are over 400 PWDs waiting for a job in the sheltered workshops. There's only one sheltered workshop, and we actually need 4 more workshops in order to accommodate all of them. So for the PWD graduates from schools, they are now sent to district support centers. So for this district support centers, are they to support PWDs in the district, or it becomes a haven for people who are waiting for daycare service? Next, Hong Kong Joint Council for People with Disabilities and the Hong Kong Council of Social Service, Ms. Winnie Chen. Now, we agree with Mr. Siu, that is about a three-pronged approach. We hope that the governments can really provide district support service, daycare, and residential service. According to Article 19 of the UN's PWDs Convention, the PWDs have this kind of choice. So I hope that for PWDs with different needs, they can have a choice as to what service they want. And also the government should face this squarely. That is, for rehabilitation sector, there is a shortage of manpower and premises. This would affect the provision of service seriously. And also PWDs need point-to-point transport service, in particular for the physically handicapped persons. If they do not have supportive transport service, they cannot enjoy community facilities. And also for District Support Center for PWDs, it started in January 2009. 4 years have passed. And we have collected data from 40-odd NGOs concerning these PWDs. Actually, each district support center has its own characteristics, and also it will provide service to PWDs according to their needs. This is a good operation experience. Now, when these contracts are renewed, maybe the government can review the services provided. And also for the 5 major services for severe PWDs, maybe the government can take a look at them again. For those over 60s, should they continue to receive rehabilitation service, or should they be referred to other elderly services? So manpower arrangements is also very important. Now there is a 3-year pilot scheme on home care service for persons with severe disabilities. We know that it will be regularized and a lot of PWDs will benefit. However, the service of this scheme should be more flexible, in particular for transport service and for the service of accompanying PWDs to hospitals, etc. All these services should be enhanced. Now, we should really look at the needs of the PWDs and then provide services accordingly. The government should try to look at the definition of persons with severe disabilities who are not waiting for institutional cares. And also there should be more statistics so that the government can provide adequate services accordingly. Next, Hong Kong Blind Union, Mr. Wong Chun-hang. Thank you, Chairman. Now, we are an organization for the visually impaired. We are very concerned about PWD's support in a community, and what is the ultimate goal for such a kind of arrangement. Now, we hope that the government and legislators can hear this. That is, as a PWD, as a visually impaired person, we don't, or I am not only asking for support in the community. That is, we don't have to be institutionalized. What we want is, after receiving such service, we can live independently in the community. We do not only need basic supports in the community, but we want to have the ability to live independently in a community. So when the government plans for future service, this is the most important direction, and it should be the focus. As for the provision of service, for some visually impaired persons, they need trainings and supports so that they can get accustomed to a life without seeing. Actually, there are people who are not, a lot of blind persons are not born blind, so they really need this kind of service. That is, they need to get accustomed to the new life, but there is only one NGO that's providing this kind of service. As for other projects or programs, they are just termed programs. They would end in 2 or 3 years' time, and after 2 or 3 years, the relevant NGOs would have to apply for funding again. So we really need permanent service in this area, and I hope the government can provide such resources. As for district support centers, a visually impaired person's needs may be different from other PWDs. And when it comes to district support, the service providers may not be able to know 100% the special needs of visually impaired persons. So when the government plan for such services, I hope it can pay attention to this. And also for PWDs or blind persons, they have told our organization that although they are enjoying certain community support services, however, the frequency of such services is inadequate. They hope that they can really be integrated into the communities they live. Next, Mr. Lam Mok Kwan from Polang Kok. I agree with the government's three-pronged approach, that is residential, community support, etc. In our daily work, many parents have told us that when they were young, they were able to take care of their children, so they would like to be with their children. So it reflects how important home care service is. The SWDs has been developing district support in the past few years, so that's why they set up the district support centers, and there were different projects launched so as to provide better home care service. But when it comes to long-term planning, some of these projects have been implemented for a number of years, and certain experiences have been accumulated. So I hope the government can consider this. Now, if you want to plan for long-term about home care service and district support, maybe you can refer to the past experience so as to map out a future direction. Community service and support are very helpful to PWDs. Now, living with one's family at home would be the best. But services would have to be provided, and this is not something new. This is actually a practical need. Professional support is very important. For example, physiotherapists, occupational therapists, in particular, when it comes to persons with severe disabilities. Now, no matter whether it's a home care or an institutional care, these professionals are very important. Also, we are living in an aging society. No matter whether it's the carer or the PWD, they are facing a lot of problems and they really need huge supports. Just now I mentioned about the district. We have district support centers now, but they are not sufficient. If the home care service can be extended to the 18 districts, and how about premises? Do you have enough places for these organizations to operate?
And there should be daycare services for those elders with severe disabilities. sometimes we don't just recruit personnel in these centers. Sometimes we're thinking of providing, say, 5 residential places in each center, side by side with the services provided by the elderly homes. Thank you, Mr. Lam. Next, Mr. Yu Chi-ming from Union of Hong Kong Rehabilitation Agencies Workshop Instructor. If you want to do your job well, you have to have good tools. Now we have the hardware, but very often we disregard the software, that is professional instructors. During the British Hong Kong government era, there were 3-year training programs for instructors before they could join the profession. We're 16 years into the handover, and the situation is ever deteriorating. Some institutions have actually lowered the entry qualifications of instructors, and sometimes their wages are even lower than those of a cleansing worker and a security guard. Given such pay levels, how can we get good quality people? And what mentality these people have when they join the institutions? They just take such jobs as transient jobs. If we don't have comprehensive planning, how can we guarantee quality? Here, many participants and officials understand quality is important because our society is people-oriented. If we don't have good quality workers, how can we obtain quality service? I hope that LegCo members can understand that society is ever advancing. For all sectors of the community, cleansing, construction, security guards, property sales, all these professions have been professionalized. But for these instructors, we've not been professionalized and we enjoy a lower pay than before the handover. And sometimes we want to attend training courses, but the institutions won't release us. You want good quality, but don't want to pay and don't want to plan. How can we solve the problem? Be it the institutions or our union, we've been striving for long-term planning from the government. We're talking about perfect planning in terms of hardware and software. Today, we have so many new rehabilitation services. They are tapping their old resources only. They're just doing the residual work left over from the past. The most important thing is to have a long-term social welfare plan. Thank you, Mr. Yu. Next, Ms. Ho-Po Ching from Forthright Caucus. Good morning, Mr. Chairman, members. I have to say sorry first because we submit our paper rather late. I hope that that paper can be included in your bundle for the reference of LegCo members and family members. Now, we're talking about quality of service, but we have to start from the problem of inadequate institutions. Well, over 17,000 people are waiting, and many elders have to wait for more than 5 years, and in the most extreme case, more than 13 years. And every year, we've only got 200 to 300 more places. The government has been lagging behind in terms of planning and provision of service. For the PWDs, from 2005 to 2008, there was zero growth, zero commitment, and we're very disappointed. Now, let me state the position of Forthright Caucus. The government has failed to provide long-term residential care services for the PWDs. There must be interdepartmental collaboration and to set targets of growth for the institutions. They must not work independently. For PWDs, there must be a case manager system to follow up on relevant services for the PWDs. Then we can reduce the need for residential care. Community support is very much diversified. Let me start with the pilot scheme on home care services for persons with severe disabilities. We're talking about what help can be provided to these people who stay in the community. The pilot scheme started in 2010. I consulted the Kaifongs, and basically the feedback was quite good. You say that starting from next March, it will be extended to the whole of Hong Kong, and 3,000 odd people should benefit. Well, I was happy in hearing that piece of news. For those queuing up for institutional care, they may be in the terminal stage of their illness. Now, I really respect these people who live so miserably in the community. And for children who are chronically ill, I really have to formally thank you for your residential care services. And for the chronically ill, your improved services will postpone their need for residential care. In fact, my views are already included in the paper. I hope that the government will pay attention to that. Next, Mr. Mak Hoi Wah, Hong Kong Association of the Deaf. Thank you, Mr. Chairman. Our association is the biggest association for the deaf in Hong Kong with over 3,000 members, but we've not been sufficient in terms of recurrent expenditure. We got some support from the Labour and Welfare Bureau and the community chest, but that's not enough. Last Saturday, we had a flag day with over 6,800 bags, much more than the 1,300 odd donation bags we had years ago. Now, for services for the deaf, we have the following comments. The government should enhance its integration services for the deaf such that they can integrate it more into society. We suggest that in different districts, sign language services should be provided in sign language centers so that medical education and social support can be provided to the deaf. For the integrated centers, they don't have sign language interpreters, so they cannot serve the deaf and those who have audio impairment sufficiently. And there must be a number of training hours for the service providers in terms of sign language interpreting, such that they can understand more the culture amongst the deaf and provide better services. Thirdly, the deaf population should be given more support and training so that they can become more independent, and the government should support the establishment of societies and associations that support the deaf. In the contract, there should be a requirement that service providers should employ more deaf persons to enhance their independency. Fourthly, there must be an inspection mechanism to provide improvement recommendations in terms of barrier-free accesses. For those who fail to meet the requirements, they should be disqualified or receive a punitive fine. Fifthly, more home care services should be provided so that deaf persons can have more choices in the types of services such that they can receive suitable services. Thank you. Next, Mr. David Chang from the Hong Kong Down Syndrome Association. Thank you, Mr. Chairman. In fact, from the name of our association, you know that we provide dedicated services to the Down syndrome patients, but in fact, we also serve other PWDs. In recent years, we more and more felt the phenomenon that our trainees are aging. This aging situation leads us into the present situation. That is, we have to simplify as far as possible the work processes so that we can match the abilities of the elderly patients. In fact, that should not be the case. PWDs should also have retirement services. So we would like to have more resources from the government and to face squarely the need of those elders who need daycare services. Of course, we're talking about Down syndrome patients. In fact, their symptoms started as early as 40 years old. As regards the use of premises, in recent days, we're thinking of an integrated center for Down syndrome patients, but the identification of suitable premises is really difficult. The SWD does provide some planners for us. However, appropriate premises are few in number, so we would like to have more resources from the administration. Thank you, Mr. Cheng. Next, the Association of Parents of the Severely Mentally Handicapped, Mr. Lee Chi-yong. Thank you, Mr. Chairman. For daycare and community support services, there are two major categories of users. First of all, those parents who are queuing up for the services for the severely disabled, 2,000 odd in line. At most, they were waiting for 168 days. Now, these people badly need sufficient support. Besides, for those parents who do not want their children to live away from them, face larger problems. The government claims that there's a lack of residential care sites, thus directly affecting on the waiting time for daycare centers. So the government should address this shortage of daycare separately. I understand that the government has the intention of making the pilot scheme a standing service. That is good, but long-term and human resources planning must be done well. For PWD centers, we have one that is still lacking a permanent premises. We need no less than 5,000 square feet per center. And in some centers, they do not have sufficient space. Sometimes they have to operate in two different premises. And you must allow sufficient space for wheelchairs. These centers are to provide one-stop services for the PWDs. At present, there are inadequate services, and the services provided may not be able to meet the needs of some patients. And most centers only provide very superficial services like short-term training courses. And for children, they should be given temporary residential care services to address the emergency needs of the parents. For those below the age of 15, services will be abolished latest by March next year. I think these children should not live in adult centers, and there are only 16 schools. They cannot solve the problems of parents as a result of long public holidays. And recently, we surveyed 77-day residential homes, and 40% of them do not have long-term care services. So how can the SWD solve this problem, please? Next, Ms. Chu-hung. Thank you, Mr. Chairman. well, we're suffering from eye problems, and we don't have three-dimensional sight. It's not myopia, it's not any other eye illnesses. So we would like the administration to pay attention to our needs. We would like to have subsidies from the SWD, but then the contract concerned does not have a Chinese version. And we also should have accident and emergency services, because eye problems can lead to other physical problems. And even for the eye clinics, we've to wait for a year before we have the next consultation. And we would like to have referral services from family doctors. At present, if a patient has not undergone any surgery, he does not get specialist referral. So you should give another opportunity to patients so that we can have another choice. That will also ease the burden on the government. Let me raise another point that seems unrelated to this issue, because I've been raising it in many places, but I was told that that is not related. Now, we cannot receive any reminders from the opticians in relation to the kind of spectacles that we need. We don't get any prescriptions, and nobody offers us any reminder. Say if we can fall very easily, we do not receive any reminder.
As for screens glasses and glasses for double images, they are very expensive. So sometimes it's very difficult for us to afford this kind of glasses. We hope that the government can give us subsidies. And also, some of us would need to seek Chinese medicine service. So I hope that healthcare coupons can be provided to us. Massage services can be provided by NGOs and social enterprises. There is already a proven need for this kind of services in community. So for this kind of services, they should be provided for all the people in need. The SWD is providing home repair and maintenance service. We hope that anti-molding service can also be provided, because you can see in the homes of a lot of PWDs, molding is really a problem, because for many PWDs, they have to be homebound. So the living environment is very important. We also hope that there can be an inter-district service. And for hospitals, car park, you can build more facilities on the car park covers or canopies. Next, Ms. Wang Chi-ting from Hong Kong University Social Work and Sociology Department. Thank you. I am a member of the concerned group for special care subsidies. Now, this has been launched by the PWDs, and this is used for employing foreign domestic helpers to take care of PWDs. Now, this has been implemented for about 10 years, but the government has not reviewed it. We found that there are three major problems. First of all, not enough subsidies. Other than subsidizing the wages for foreign domestic helpers, there is also a meal subsidy of $895 per month. So this is really far from sufficient. Now, for a CSSA recipient, its meal costs $1,161 per month. So it's much more than this $675. And also for foreign domestic helpers, they cannot enjoy $2 public transport concessions. So they have to spend about $500 on public transport every month. So we hope that the meal subsidy can be increased, and also $900 should be provided as a public transport subsidy. And also the eligible criteria are too stringent, and most of the time the PWDs would have to live apart from their family members in order to be qualified. So many of the people who have to live away from their parents or even from their spouses. Now you're encouraging PWDs to live in the community, and for paraplegics, actually, now you are encouraging them to live alone. Now, do you want to sacrifice your family members in order to live, so-called live independently? So we hope that the government can do this. That is, for paraplegic patients, they should be encouraged to live with their family members. And the last point is, after our studies, we discovered that for SWD staff, they really don't know too much about special care subsidy. They even suggest the applicants to go online to search for information. So for able-bodied people like us, it's easy. However, try to imagine if you even have difficulty turning on a computer, if you are a paraplegic, how can you do these kind of things so easily? And actually, you're right. So we hope that the SWD frontline workers can have a better understanding of this kind of subsidies. The government, or Mr. Siu has also mentioned this, that the government is trying to provide services in 3 areas. So it seems that this special subsidy is not that important. However, we would like to stress that even though the government has a good policy, if you do not implement it thoroughly, then the PWDs cannot enjoy such help. So we have already submitted a very detailed paper. Members can refer to that. Thank you. Next, Mr. Ip Wing from Labour Party. We regret what the government is doing when it comes to daycare and community support services. And the waiting time for government services is very long, and the longest one on the waiting list is he started waiting since 2006. Now we have daytime places. The number of daytime places now is 391. And only 160 more people have been serviced in the last year. As for sheltered workshop, the waiting time is also very long. When there are more and more people in the waiting list each year, the service provided is far from enough. So for PWDs, the physical condition may deteriorate, and their carers may suffer a lot of problems, in particular their aging. So what is the government waiting for? Now they have to spend hundreds of dollars to obtain private service. This service is very expensive, but they want to improve their life or the lifestyle. So, and they cannot enjoy CSSA. It's really difficult for them to make the ends meet. However, although there is community care fund, but the threshold is really high. You have to do a lot of means tests, etc. So that's indeed not helpful. That's why the PWDs are doomed to stay with this miserable life. Now, PWDs are like balls, they are being thrown around. No institutions would accept them. And for foreign domestic helpers, after a 2-year contract, they have to take a long leave. So what are we going to do with the PWDs? And if the parents of the PWDs are hospitalized, then what would happen to the PWDs? Have you thought about that? We have 3 suggestions for the government. The government should provide subsidies and subventions. You should not shirk all the responsibilities onto the family members of the PWDs. And also a special PWD subsidy should be provided so that the financial burden on their families can be alleviated. And also more services and long-term planning should be provided for. Next, the Hong Kong Joint Council of Parents of the Mentally Handicapped. We are very concerned about respite service and adult service. These two services are very important for supporting PWDs. As for respite service or residential respite service, we have certain proposals. Now there are schools with dormitories, so residential respite service can be provided in these schools because they already have the facilities. We should make full use of such facilities, and by doing so, public money will not be wasted. And also in our CHDs, yes, certain residential respite services are provided. However, for wheelchair users, it's very difficult to use this kind of service. Now, if you call these out CHDs and they discover that if you're using a wheelchair, then they will say that there is no place left. Now, in the coming year, residential respite service will be cancelled. And I strongly object to that. Well, for families like us, we really need this kind of support. Without this service, we have to shoulder a even more heavier burden. So I don't think this service should be abolished. Actually, the service should be extended to more RCHDs. Just now, we talked about sheltered workshop and day activity center, and the places are far from adequate. The waiting time is very long. We hope that more institutions can be built so as to increase the number of beds, in particular residential care homes for severe PWDs. And also for the pilot scheme on home care service for persons with severe disabilities, it will be regularized next year, and we welcome that. I hope that SWD can review the quality and quantity of the services they provide. Thank you. Next, Hong Kong Federation of Handicapped Youth, Ms. Portia Choi. Thank you, Chairman. Well, we were established in 1970. Is a charity organization for handicapped youth. We are very concerned about PWDs, in particular persons with physical disabilities. We have the following positions. We agree that the government suggestions that they will be providing home care and support service to PWDs with less severe problems. However, for persons with severe disabilities, while they are waiting for RCHDs, if this kind of service can be provided to them, then you can ease the burdens of many carers. The pressure on their family members can be alleviated. Now, as service beneficiaries, we hope that we can have a choice. Now, no matter whether I suffer from severe disabilities or not, I hope that there can be a choice. Now, if there is a home care service, I would choose it. But if institutional service is better, then I can choose institutional service. So the government should set targets to increase the number of places in institutions so that the waiting time can be reduced. Now the waiting time is 3 years, and people's lifespans are getting longer, so there are a lot more people in the waiting line, and there will be more and more demand for institutional service.
Many people became disabled, and many of them are over 50 years old. They need a great deal more institutional care. So there is an urgent need for more residential places. The waiting time for the severely disabled at the moment is really very long. So apart from announcing the figures, there should also be figures for the PWDs at a minor, medium, and severe level. And for the planning of residential care services, we're of the view that premises should be earmarked for small and medium care centers in newly constructed public rental housing estates. The details of our proposals are already set out in our submission to the LegCo. Next, Mr. Lo Wai-Cheung from 嚴重殘疾人士關愛小組, which means a care group for the severely handicapped. Mr. Chairman, can you hear me? Yes. I very much agree with Mr. Siu, the Commissioner, that there should be a three-pronged approach in taking care of the problems of the PWDs. So the three-pronged approach mapped out by him is worthy of our support. For home care and community care, planning and quality are equally important. At present, the quality of service is really very poor. PWDs don't receive comprehensive care. Not even basic care that should be rendered to a normal person. Today, I originally intended to bring a PWD friend here to assist me in expressing our views, but because of transport problems, he could not come. He would like me to speak on his behalf. He is severely handicapped at 40-odd years old, and he has been disabled for 10 years. He now relies on a home carer, servicing him 3 sessions a week. That means he can only take a bath once every 3 days. This is not even basic service. On Saturdays and Sundays, he don't have meals because there's no meal distribution service on Saturdays and Sundays. In fact, these patients need 24-hour service in the community, but that's not done at the moment. And this friend of mine told me that once on several occasions, he went to the toilet in the middle of the night and fell. And when he sought help from the family social worker, he was asked to apply for residential care, but he does not know for how long he has to wait for such service. In fact, that's not his choice. He would like to stay in the community, but unfortunately, the government has failed to provide even basic services. So we're not even talking about quality. We're not even talking about the right to choose. As for the pilot scheme, can you do it in such a way that these patients can stay at home and have their night needs met? Now, these people are not qualified for other subsidies. So in the government's review and planning work, PWDs can be allowed to participate in planning. That is very important when it comes to policies. If you don't have input from the PWDs, in the end you'll get a disabled plan, so to speak. Next, Mr. Tung. Mr. Chairman, I do have expectations of the CCF. I think you should examine how to assist the low-income people and the disabled persons. But before you do so, the CCF should continue. And the subsidy should be increased to $2,000 to $8,000, depending on the case concerned. Some people need more, then you should give them more. But at least there should be $3,000 in order to meet the present commodity prices. Because if you want to employ a home carer to help you bathe and go to the market to buy food, you need at least $60 per hour. And for physiotherapy service, $51 per hour if the physiotherapist is to go to your home. So the median range should be increased to 150%. And when you count family income, you should pay special attention to the needs of the PWD family members. And age limits result in age discrimination. Let me cite myself as an example. The older I am, the more expenses are incurred. So it is absurd to say that when a person reaches 60 years old, you won't give him any subsidy. Because once a person reaches 60 years old, he suffers more from illnesses, and ancillary facilities like diapers will be needed more. At the moment, subsidies are not adequate. If you are to give up the PWDs above the age of 60, if you have conscience, how can you come up with such an incompassionate formula? I benefited from the CCF. And the CCF has helped me a great deal in terms of daily life and social functions. And sometimes I have some money to replace damaged parts of my wheelchair and go to receive water therapy, etc. So I have to thank the CCF. But then very soon I'll reach 60 years old and the CCF will no longer assist me. Then I won't be able to attend outdoor activities. Then my health will deteriorate even quicker, thus adding to medical expenses. My son told me that in terms of basic living needs, he can support me, but for my disability, he won't be able to do so. So there should be equally good services for the severely handicapped so that they can lead a dignified life in society. Thank you, Mr. Tung. Next, First Step Association, Mr. Yip King Kung. Thank you, Mr. Chairman. Can you hear me? Yes. Sometimes I doubt whether or not the SWD staff understand fully the needs of the PWDs. We're told that the SWD readily tells you to receive residential care instead of advising you to stay at home. So how much do they know of community care? Just now some friends mentioned CSSA recipients. Not many people are concerned about the non-CSSA recipients. Now, there must be funds to support these people's living. Secondly, there must be sufficient rehabilitation equipment. And thirdly, there must be sufficient care for these people if they are to remain at home and to live in the community. I heard that many family members would like the PWDs to leave home as soon as possible. Because concessionary fares cannot be obtained if PWDs still stay at home. So the government is forcing families to separate. And there is this contradiction between CSSA and provision for the PWDs. Very often the government is expanding, ever expanding the burden on family members in the caring of the PWDs? Well, frankly speaking, I am not convinced when I am asked to pay tax. I would like to know how much of my tax is spent on care services for the PWDs. There should be disability allowances to subsidize the non-CSSA recipients such that they can, say, employ carers. So you should consider assistance for the non-CSSA recipients. For rehabilitation equipment, the PWDs have to spend tens of thousands or even hundreds, over $100,000 on the replacements of such equipment. That's about $4,000 per month. So how can family members afford that? So subsidized services should be considered to alleviate the burden on these families and PWDs. Otherwise, they cannot stay in the community. If you force them back to residential care, I will stay on as an unconvinced taxpayer. Next. Well, sorry, Mr. Chairman, I'm not very familiar with your rules of procedure. Apparently, in these hearings, deputations are speaking to deputations. Can government officials be asked to state their position again so that deputations can ask them questions? In fact, we among the deputations know one another very well. In fact, in 2009, the SWD got 16 centers. Now it's 2013, it's April now. I think Mr. Siu understands what I'm saying. I think it's time for the SWD to conduct a review on the 16 centers. And please pay attention to these. For the 8 major services, we're told that the 16 centers take care of different categories of PWDs. That sounds good. But just now, we heard that there are not sufficient staff who are conversant with sign language, for example. So the SWD should tell us how they'll address such inadequacies. Thirdly, there's a shortage of residential places. We get 5 per center, but 16 years old is the threshold. Once you reach 16 years old, you can receive the daycare services. So what if a person reaches 16 years old? I'd like to hear something from the SWD. By the end of 2012, this $2 transport subsidy was offered. Some institutions are offering $10, more than the $8 offered by the administration. And for the 16 centers, will they extend their hours of service? Family members have to go out to work. I think such service centers should not operate like officers. Officers work 9 to 5. PWDs have been telling us they have needs at night. So why should it be 10 to 5? One of the 16 centers, Central and Western, covers the islands as well. You know that we have the center in Changquano with a lot of tetraplegic patients. So how many PWDs are sharing the service of these 16 centers, do you know? It's just like district councils. They should have district officers round the corner in every district. Well, can I continue with my conclusion? I hope that in the upcoming review, the SWD will take care of all sorts of problems, including the aging problem of the tetraplegic patients. In Hong Kong, we don't have a dedicated center or an institute to train personnel to take care of different categories of PWDs, and we rely on training of the frontliners. I understand that there's a cash subsidy for the attending of training courses, but some social workers and carers told me that they were unable to identify suitable services. $3,900 for the employment of home cares is just like the pay for foreign domestic workers. That started in 2003. I knew that there was this elder, 70 years old, who cannot adapt to foreign domestic helpers. So $3,000 you can't get a local carer. We heard that it's $60 per hour. So in reality, you won't be able to get somebody to take care of you at home. So if there's a medical certificate, can you get this detached from the pay for foreign domestic helpers? Thank you.
Thanks, Mr. Kang Wai-kun. I'm a frontline worker in this area. In the past few years, the SWD has been providing more diversified services, and that's quite good. But I still would like to make a few points, and I hope the government will face them squarely. First of all, about the manpower ratio. Now, it is due to the block grant arrangements, and now the NGOs have less resources. And we see that the NGOs are facing a lot of difficulties because now many of them cannot recruit sufficient staff. For example, if they cannot recruit a nurse, they can only resort to recruiting a carer. So they cannot provide for the needs of different PWDs. So you should really look at the funding. More funding should be provided. Now, we are talking about long-term care for PWDs. And also for persons with severe disabilities, they even need more resources. So the government should not be saving money in this area. And also for a lot of NGOs, it's sometimes very difficult for them to recruit people. For private healthcare providers, they are offering better pays and terms when they recruit people. So for public bodies or NGOs like us, it's very difficult for us to fight with them. So I think the government should really look at this. Now, for our services, we really need professionals. And just now we also heard about trainings. Our colleagues said that more trainings should be provided to the PWDs and their carers, as well as service providers. Now, other than social workers and physiotherapists trainings, I think there should also be trainings for tutors and carers. And this kind of training programs should be incorporated into tertiary education institutions' curriculum. I think City University has a 3-year program in this regard, but this is not a regularized program. After this 3-year program, maybe another institution would take up the program, so continuity cannot be ensured. So we think that more regularized trainings should be provided. Thank you, Mr. Kang. Last, the Hong Kong Joint Council of Parents of the Mentally Handicapped, Ms. Yu Chang Pui Lan. Good morning. Ever since 2005, the SWD has introduced a residential care home system for persons with severe disabilities. However, for those with less severe disabilities, now they are deprived of many opportunities now, because for sheltered workshop and day activity center, the number of them has not increased in the past years. Now, there are certain employment opportunities provided for PWDs. In the year 2006, more services in this regard were provided. However, these kind of services cannot replace the day activity center and sheltered workshop. So after graduation, many PWDs do not know what to do, and it becomes a burden on parents. I understand that parents have the responsibility to take care of their children. However, for the underprivileged, this is really very difficult. So for persons with less severe disabilities, this has become a major problem. They cannot find a job in the proper manpower market, and the parents have to take care of them 24 hours a day. And for persons with mentally handicapped, they cannot be engaged in normal social life. So the parents would have to take care of them all the time, and they're under a lot of pressure. Well, many people do not understand this kind of pressure on the parents. And sometimes these children may even develop mental problems, and it's very hard for the parents. Now, originally, these children are okay, but if they cannot receive proper service, then they may develop psychological problems. We hope that more daycare services can be provided. For example, the establishment of more daycare, day activity centers, and daytime sheltered workshop, because the number of them has not increased in the past few years. I'm not talking about residential service. I'm only talking about day service. And also for carers, they should also be trained. For parents like us, if our children can go to these centers in the daytime, then the parents can take a rest in the daytime, because after graduation, in the past, they could work from 9 to 3 in the daytime, but now they do not have such a place to go. And a parent told me that her child has to go from Tung to Tung groups of hospitals, and the child can only spend 1 or 2.5 hours there, but they have to spend 4 hours on the way. I just talked to her yesterday, and she said that her child can only jog every day. The child is suffering from mild disability, but he has nowhere to go in the daytime. So I hope the Commissioner can think about this. That is, we need daytime sheltered workshop and day activity center. And also for the 16 districts, please be quick. Well, you are talking about 16 centers, but 5 of them are not open yet. That is the community support centers. You are planning for 16, and 5 of them are still not opened, and they will only be open in 2014. And you are talking about 5,000 members. Actually, for each center is about it's more than 400 people. You have to serve more than 400 people in such a center, and some of these centers are 3,000 square feet big only, so that's far from sufficient. I would like to thank all the deputations for sharing their experience and views with us. Just now, one of them asked if these deputations can communicate with the governments. Actually, we are having this meeting for communication. However, the structure of our meeting is like this. Now, the deputations would have to speak first, and then members can ask questions, and then the administration can answer. Now, later on, we will invite members to speak again if there is a need. So I hope that you can understand that this is the structure of our meeting. I would like to invite the administration to make a response to the views expressed by the deputations just now. I would like to summarize a bit. And actually, those views cover a lot of areas. First of all, it's about the shortage of RCHDs. Now, today we are mainly talking about daycare and community support services. Now, for the district support centers, one of the deputations said that now they do not have, up to now they still don't have a permanent premises. So the government really have to review all the hardware provisions. And also for the residential respite service, it will be abolished soon. And our deputations are very concerned about this. And for care for adult PWDs, there is a huge shortage. As for special care subsidy, some users have told us the difficulties they face. Now you have integrated home care service, but we've heard that there are a lot of problems. Mr. Lo Wai-chung said that on Saturdays and Sundays, no meals will be delivered, and only 2 or 3 baths can be taken each week. And also for daycare, well, it's seriously insufficient. We're talking about waiting time of 6 to 7 years. In Tai Po, in Yuen Long, and North District, these is particularly a serious problem. And for services like this, most of them are residential services. But for PWDs with less serious problems, they can't even be put in the waiting line because they are not serious enough. And also for people with visual impairments and hearing impairments, they cannot enjoy adaptation services. And also PWDs are aging. This also bring about a lot of problems. And also for your pilot scheme is not flexible enough. Many deputations have mentioned this point. So, Commissioner, would you like to respond to all these points? Thank you, Chairman. Maybe I'll focus on our direction of development first, and then I will also answer some questions concerning operations. For example, District Support Center. My SWD colleague will also supplement. Now, with regard to what the Chairman said just now, I have also put down a few other points. For example, the provision of daycare service and RCHDs, there is a serious shortage. Yes, we understand that there is a huge demand. So for RCHD service, there is a huge problem concerning manpower and premises. Now we are looking for new sites for this purpose. In the coming year, we will be adding 526 places. And by 2017 and 2018, there will be 2,100 places more. In the coming year, there will be 426 places. And by 2017, we will have 1,600 places. But we will not stop here. We are now planning with other departments. We hope that more premises can be provided. We hope that the number can increase. We are actively talking to NGOs because many NGOs now own lands. So we hope that the lottery fund can provide flexible funding so that such lands can be redeveloped and more elderly home places and rehabilitation places can be provided. Now, many deputations are concerned about manpower. We are also concerned about that, in particular paramedics. 2 years ago, we made a planning and the relevant data have been given to the relevant government departments and the UGCs. For example, for the training of physiotherapists, now the number of places has increased from 70 to more than 100. As for occupational therapists, the number has also been increased to more than 100. We need more people in the social welfare sector. So for physiotherapists and occupational therapists, we are now discussing with the Polytechnic University. We have a cooperation program, and a master program will be launched soon. So for occupational therapists and physiotherapists, there will be 30 places in each program in the future, and they can join the field after 2014.
For nurses, we have more places in the universities, and we have got courses for enrolled nurses with 1,500 places. Upcoming, there will be another 1,200 places. So overall speaking, we would like to provide sufficient qualified personnel to match our service plans. And just now, many friends mentioned transient care. In terms of need and policy, we'll continue to provide such services. At the moment, the SWD is following up the situation with the institutions. They're now discussing the details and will actively follow up on the issue. Today, many friends have spelled out the demands for services, so we'll continue to provide such services. And many friends mentioned non-CSSA severe PWDs. And previously, the CCF also targeted low-income PWDs. There's a special care subsidy. And for those who need supportive equipment like respirators, there's also a special subsidy, $2,000, and another $2,250 for the respirators. And there are other heads of subsidies as well. We won't stop there. In the policy address, it said that the SWD and the Labour and Welfare Bureau are actively considering a case management system. That is, for non-CSSA low-income PWDs, we would like to normalize and rationalize the existing services. As regards the actual amount of subsidy, I understand that the CCF has established a working group to follow up on the issue of inadequacies of subsidies. Some deputations mentioned barrier-free accesses. Of course, that's not today's theme, but I'd like to say that for barrier-free access, the administration will continue to handle 3,500 government premises and 200 housing department premises. We'll complete the job by the middle of this year. At the moment, through the URA and the Housing Society, a subsidy is offered to private landlords, such that when they carry out renovation, they'll provide barrier-free access to the PWDs. And this year, we have another 6 rehab buses, thus making the whole fleet to 135 buses. Rehab buses do go to remote areas at the moment. In accordance with the actual demand, we'll further explore the issue. Some deputations mentioned employment. Of course, today's focus is not on employment, but will enhance our services on various fronts. We'll provide work incentives to the employers, and a $4,000 will be given to an employer employing PWD employees. Another monthly subsidy of $5,800. And for the SWD, for every PWD employee, $20,000 will be offered to the employer to improve the workplace to suit the PWDs. We have a dedicated task force to consider further improvement measures so that the government, the NGOs, and private companies can think of further improvement measures to assist the PWDs, and will consider these suggestions from the deputations today. We've actually read in detail the submissions. We'll go back and analyze all views received very seriously. I'll refer them to the relevant bureaus and departments as well. Maybe the Assistant Director of Social Welfare can supplement. Thank you, Mr. Chairman. We heard very clearly the views of the deputations. We very much understand that PWD friends do want to stay in the community. So we must provide matching services to assist them to stay in the community. Apart from enhancing and improving our residential services, we have to increase the quotas for day training. From now to 2017-18, we'll provide a total of 2016 day training places, including what's asked for by the parents just now. Now, these placement, there are placement quotas. 1,036 of them, more than half of the total. And then for sheltered workshops and occupational rehabilitation centers, offering about 998 places. Therefore, I would like to say that we'll continue to provide more residential services for the severe PWDs, but we've not forgotten day services, which need to be enhanced as well. As for the district support centers, they started in January 2009. They aim at providing one-stop services. At present, we have 16 district support centers, one of which does not have a permanent premises. All the remaining 15 have got permanent premises. And renovation is being planned at the moment for these centers. So I hope that shortly these district support centers can operate in their permanent premises. As for the remaining one without a permanent premises, we actually offer it a subsidy such that it can rent commercial premises for the provision of services. Some parents mentioned Tuen Mun and Tai Po North, which have inadequate placement services. I did have the opportunity to meet with a group of parents. Let me say this, for Tai Po North, within this financial year, there will be an in situ expansion plan in the hope that we can provide 30 additional placement center quotas. Now, this is not matching in nature. That means they are really for those in that community. They may not be in our daycare centers, but vehicles will be provided to transport those who are in need to this Tai Po North Center. As for Tuen Mun, we just went to the Finance Committee. I'd like to thank member support for our new service plan in Tin Ching. We hope that by the first quarter of next year, we'll provide those extra places to the Tuen Mun patients. Of course, transport arrangements will also be made to ease the problem in Tuen Mun. Concerning these placement centers, there were comments about the operational hours. Now, these centers operate 48 hours a week. Of course, different centers may have different operation hours to suit the situation in that particular district. But basically, the number of service hours is 48 hours per week. some deputations have asked for a review. The duration of service for each recipient in the placement center is 4 years, but we've been telling parents and parties concerned that in accordance with the actual circumstances, for example, the problems encountered in these placement centers will join hands to identify problems. And of course, for the district support centers, we understand that due to the wide variety of disabilities, different services will be needed. Hearing impairment was mentioned just now. We do have recreation centers. The SWD is supporting 16 recreation centers and social centers. And 4 do serve those with hearing and visual impairments. And I understand that sign language training courses are also provided for those with hearing impairment and able-bodied persons in the hope that they can communicate with one another. For those with visual impairment, we also provide other services for them. Of course, we have to monitor the various types of services closely. And Mr. Chairman, allow me to say something about normalization of home care services. That is to be implemented in March next year. We'll see what more improvement can be made for home care. When we decide on the standard of service to be provided, we'll seriously take on board the views from the deputations. And as Mr. Siu mentioned just now, our personnel do work within certain operation hours, but we do take into account the actual needs of our targets of service. So we'll further discuss this with the service centers. Parents can rest assured that we'll do what should be needed. 270 transient residential places are provided, of which 148 are for those PWDs below the age of 15. So much for the time being, Mr. Chairman. Well, time is limited. We should end at 12:45. But if members so consent, can we extend that by 15 minutes up to 1 o'clock? Well, Chiang Kwok-chi, Joseph Lee, Tung Ka-piu, Siu Ping, and Tam Yu Jong. 5 members have signified their wish to speak. 4 minutes per member. Mr. Chiang Kwok-chi? Thank you, Mr. Chairman. I'd like to thank the 20 deputations and individuals for attending this meeting to offer us their views. In fact, this is not the first time we hear such views, but every time we heard the same answers from the administration. I believe in half a year's time, when the same deputations and individuals come, we'll hear the same comments. I feel helpless and annoyed. If you look at the administration's paper, you see that if foreigners come to see our services, they'll feel very happy. It seems that PWDs are categorized in accordance with the type of disability. And then we provide community care and day care as well as residential care. But services are inadequate. And at the end of the day, there are bound to be people. We are about to have people who say that services are inadequate, and some of them have not been able to receive the service even at the time of death. Let me cite a simple example. Just now, we mentioned the DSC. 470 social functions, 2.5 per month on the average. PT and OT, 948 sessions, that is 79 sessions per month. Support activities for PWDs and their carers, 640 per year, that is 50-odd per month. If you continue to count, you discover that according to the SFA, that is the service agreement, so much has to be done. I can only say that our colleagues are working day after day, incessantly.
And when I look at ICCMW, it's really great. We have over 290,000 people that have been served, and there have been 5,700 sessions or activities. Now look at all these numbers. You can see that our colleagues are providing a lot of services, yet there is still a huge shortage. So I would like to ask the government. Now, because some service users told us that now no newcomer is allowed in a waiting line because the institutions or the relevant organizations are asking people not to join the queue because there will be no more places. So did the government tell the NGOs to do this? We know that some NGOs are asking people not to wait. So is this the SWD's instructions or what? And also some deputations mentioned it. Sorry, Chairman. I just expressed my views. Yes, we will ask the administration to answer later. Mr. Lei Kwok-lun. We'd like to thank the deputations for coming. Well, we've heard a lot of problems from them, but the SWD and the commissioner told us there's no problem. So I have several questions to ask. Now, the deputations mentioned this. They say that pay is very low, so it's very difficult to recruit people. So service quality is affected. So how does the government monitor? Yes, there is this lump sum grant, and you ask the NGOs to work. So how do you monitor the expenditures of these NGOs so that the money is used properly? Some deputation told us that for certain NGOs, they cannot hire, they are not able to recruit nurses or therapists. And now you are giving the NGOs a lump sum grant. So have you specified as to how these grants should be used? And you are saying that you are adding new places. There will be 1,200 more nurses, but that's after 2014, so you cannot solve the immediate problem. And after training more nurses and occupational therapists, you are saying that there will be a polytechnic university new program. So how can you keep these people? They can sign a 2-year contract and then they are gone. Well, for EN for mental health patients, their pay is just 0.9. So they may not want to stay in those institutions. Is it a system problem? There's no promotion opportunities, or is the pay particularly low because you are providing the funding? So how about monitoring? Because all these problems cannot be resolved. Now, some deputations mentioned that they have no premises. So I understand that's the problem. That's the not my backyard mentality. Well, fortunately, they do not have premises. Otherwise, if they've set up a center, who's going to serve there? Because your monitoring is so poor. You don't know how money is spent by NGOs. So it's just like what the member said just now. After half a year, we will be repeating this same discussion. And the frontline workers have to face a heavy workload. And PWD seems to be doomed. Okay, manpower, quality of service, monitoring, keeping talents in the institutions, etc. All these are problems. Mr. Lam? As for monitoring performance, I would like to say something about that. For the lump sum grant, if an NGO gets funding from the SWD, it has to sign an agreement on service and subsidy, and the services they provide have to be set out very clearly. And also, there will be a service performance monitoring system. We will conduct surprise checks. We will go to these service providers and see how they are providing service. And when they go to such service providers, they will also talk to the service targets directly so as to get their feedback. That is, whether they are satisfied with the service provided. So this is how we monitor the service. Mr. Tan Ka-piu. Thank you, Chairman. I would ask some questions. And maybe the Chairman should decide as to whether this should be discussed by us or by the welfare panel further. Now, some deputations mentioned about people with mild intellectual disability, and they want to be integrated into the community. So I hope that we can talk more about the employment problems of these people. I'm most familiar with Tung, and I understand that there is a practical problem. Although there is much land on Lantau Island, however, there are no buildings there, so they do not have any premises. You are saying that there are 16 district support centers for PWDs. So how big are these centers? Are some of them under 5,000 square feet? You are saying that there is Store 1 DSC that has not been built. So how can you ensure that this service can be provided in the future? Some parents told me that they have to go from Tung to the Western District of Hong Kong Island to receive this kind of service. So this is really counterproductive. So please tell me how you are going to help people obtain this kind of service. As for the census on PWDs in Hong Kong, in the past, persons with intellectual disabilities were excluded. Now, this census was conducted 6 years ago. So when will the next one be conducted? Will you also cover persons with intellectual disabilities? Just now, we also talked about human resources. Now, for the pilot scheme on home care service for persons with severe disabilities, it will be regularized. And if the residential respite service is also regularized, how much more pressure will there be on the manpower issue? I would answer the simpler questions first. As for DSC, maybe the SWD staff can answer that. As for the census, as Mr. Tang said just now, was conducted in 2006 and 2007. It's not that persons with intellectual disabilities were not covered. It was that they found some they found that the figures were not reliable. So in the footnote, they say that they should look at the government's figure. At that time, the figure was about 67,000 persons like this. So now we are asking them to pay more attention to this. There will be more trainings, and also when they design the questions, they will pay more attention. This year they are conducting the census, and next year we will get new figures. As for manpower, as I said just now, other than increasing school places for training paramedics, we now also have master programs for physiotherapists and occupational therapists. In January 2014, they will graduate. Because this is a subsidized program, so they would have to work in the social welfare sector for at least 2 years. Mr. Lam? As for DSC, in particular for the one without a premises now, because the area they have to serve is quite big, so we have to adopt a pragmatic approach. Now, if they can find a big enough place, of course, they can do it. But maybe we need 2 premises because they need to serve people from a large district. So if there are 2 premises, maybe that's even more convenient. Mr. Tang asked us what we are doing. Now, no matter whether it's our district staff or our head office staff, in the past few years, we have been trying very hard to find suitable locations for setting up such centers. Well, sometimes it's very difficult to rent a place like that. And in commercial premises now, we are renting units for this kind of center. Mr. Tang asked about the size of the center. For permanent centers, they are of appropriate size. But for some DSC, the location may be right, but the size may be a bit smaller. But we do not have many DSCs like that. Well, for care and support for PWDs, many people have expressed a lot of views today. And I hope the Commissioner can take their views on board. Now, when I look at the paper, it seems that the pilot scheme is enjoying good response. And in March next year, the government will regularize the pilot scheme, and $203 million will be earmarked for this service each year. Now, there are more than 7,000 people waiting for RCHDs. And you are saying that 3,200 people will benefit next year. So how did you come up with this figure? What kind of information are you relying on? And do you have enough manpower and resources? And you are talking about $203 million. So would that be sufficient for all these manpower requirements?
We estimate that about 3,250 people will benefit from the normalized care services. For those queuing up for residential or subsidized residential care services, well, basically we have homes for the severely handicapped and the severely physically handicapped. Of course, not all who are queuing up at the moment will come forward to receive services from these new places, because under the pilot scheme we've got some experience as to what the demands are. And for those who are not queuing up for any service, for the severely handicapped, will provide more. For those with no matching services, like those in sheltered workshops and placement centers, that is, those with severe handicaps, we have special schools. Students of special schools also need these services. So we'll consider the other categories. Some of them may be receiving services at our district service centers, district support centers. Some of them are also persons with severe disabilities. In other words, how many will fall outside of your quotas? As you said, only 3,000 additional places will be provided for all those different types of PWDs. Not all those who stay in the community would like to receive services. In fact, we've been drawing experience from our pilot scheme. On the average, every year, there will be about 3,000 beneficiaries. Well, you asked for an allocation of $200 million. I believe the LegCo can accept that, but we would like more people to be served, such that those who need the service can get it. Given this 3,000 additional places, I'm not sure you can satisfy the demand. According to your experience, that should be enough? Well, in the pilot scheme, we had 540 quotas for 4 districts. Now, the pilot scheme was in place for 2 years. Almost 460 persons are receiving the service. So it's on that basis that we did our calculation. Next time, Chiu-hung. Mr. Chairman, I'd like to thank the deputations and individuals who've come today to offer us their invaluable advice. I consider their arguments reasonable, so I'd like to see how the administration will follow up on that. Last Sunday in Tung, I encountered a PWD in an electric wheelchair, and he would like me to relay his views to you. He said that electric wheelchair is important to him so that he can move around. But he said that those bricks on our pavements could subside as a result of rain, and wheelchair-bound persons may experience a bump leading to backbone injuries and so forth. So I'd like the administration to do something. Of course, I understand that this is not the work of your department, but Commissioner, can you relay this message to the relevant department? He also mentioned the medical the vouchers for the elders, $1,000 for those above the age of 65. But no such vouchers for the PWDs. I mentioned the hospital authority. He said that there's Chinese medicine practitioners in hospitals, but not for bone injuries, the bone setters, no bone setting service. And also, there's no lift in this Twin Moon complex. And there's a Chinese restaurant in it which he cannot access. Well, we often talk about barrier-free access, but that commercial complex fails in that regard. Some deputations mentioned rehab bus service. PWDs who live in remote areas, if they want to come out, do you have any plan to improve the rehab bus service? Commissioner, I'd like to thank Mr. Tam for his advice. We'll relay them to the Highways Department, the Food and Health Bureau, and the Link Read for follow-up. In fact, a lift should be provided to that complex under Link Read. Rehab buses go to anywhere in Hong Kong, and they do go to remote areas. It really depends on service demand. If they run on fixed routes, rehab bus services would be planned in accordance with the actual service needs. For wheelchair-bound persons, rehab buses do provide point-to-point service. We'll follow this up. Commissioner, what about medical vouchers, healthcare vouchers? Well, as I said, I'll relay that to the Food and Health Bureau. Mr. Tam, any more follow-up? So we've finished the first round. I'd like to follow up on a number of issues. Just now, the Commissioner said that for daycare service, you're continuously identifying suitable premises and increasing the number of quotas. But the reality is that the waiting time can be as long as 6 to 7 years for placement centers and sheltered workshops. Now, this situation is serious. There is no reason for the PWDs to wait at home. You mentioned district support centers, but from Monday to Saturday, there's no comprehensive service for the PWDs. Do you have any plan or objectives to reduce the waiting time? You continue to work hard, but the queue remains so long. We're over a decade into the handover. The fact is that the queue is getting longer and longer. At least in Tuen Mun and Tai Po North, you should provide more quotas. Still, it's just like a drop in the ocean. There are just inadequate places to go around. Well, even for Tuen Mun, you have 400 places, but that's still not enough. For normalization of existing services, I'd like to say that there are limitations. There must be SWD referral, and meal delivery may not be included. Now, the pilot scheme has been in place for over 2 years. You said that the service is also for those who are not waiting for residential services. But what about flexibility in terms of servicing hours, waiting time, and so forth? For day services, is there any room for review for the pilot scheme? Like residential services, we know that day services are not enough. Up to December last year, 3,700 odd people are still waiting, according to the SWD. This year, we'll get 426 more day places. And then by 2017, we'll get 1,600 more. Altogether 2,000 odd, but there's still a shortage of 1,700. We're closely discussing with the Housing Department, Lands Department, etc., to identify suitable premises. And we're actively discussing with the NGOs, which possess a great deal of GIC sites. Our requirement is that after redevelopment, priority should be given to elderly services and rehabilitation. Then we'll support a more expeditious processing of the redevelopment program. As I said, we're not setting 2,000 as our ultimate objective. Our objective is to include all those who are waiting, and we are working hard. I understand that the SWD is actively improving their operations. I understand that the SWD will also continue to discuss with the NGOs. Second round, Mr. Chung Kok-chi. I need only 1 minute, Chairman. Just now, Dr. Joseph Lee asked a question. Of course, the government has monitoring teams, but the best solution is for service users to monitor the service. I suggest that all servicing units with expenditure ranging from $1 million to $10 million on daycare and community support services, they should tell us why they have the present establishment. So that when we visit a particular center, for example, we can ask questions like, you should have 3 people, why only 2 at the moment? Commissioner or Mr. Lam, is that possible? To ask every service unit to explain their manpower strength. Well, we only need those subvented by the government, not all service centers. Well, Mr. Chairman, under the block vote system, we don't monitor and control the scale of manpower, although according to the service agreement, we set out what personnel are needed. Service effectiveness as well as service quality are set out in the agreement. But what about the level of subsidy? It is based on manpower establishment. Can you give us the formulae for each type of services? Can you give that to Mr. Chung? For rehabilitation services, we've got a manual which sets out the requirements and establishment for most rehabilitation services. But of course, that's only a reference. Mr. Chung, that's better than none. Service manual. Well, I read the service manual many years ago. After the block vote system was introduced, that manual remained a reference, not a requirement. Yes, that's a reference. Chairman, as I said, under the block vote system, we basically look at the quantity of service and effectiveness of service. Well, Mr. Chairman, they only need to enrich the manual, which does not include new services. Can you include the standard of new services into the manual as well? Mr. Chairman, as I said, we mainly focus on quantity and effectiveness of service. Well, after the first issuance of the manual, we did not update it because we now have the criteria of the block vote system. When was that published? I think it's around 2006, 2007. Anyway, please pass the information to us as well. Mr. Tan Ka-piu, very quick, Chairman. Just now, when the director mentioned Tung and the outlying islands, well, I think they allow sub-centers. I think they're passing the buck to the service provider. But in the urban areas, there's a lack of suitable premises. Can you take the initiative to contact Link Reed and other service providers? In Tung, I believe for some years to come, space would still be available for PWDs in remote areas. In Link Reed premises in Tung, there's still empty spaces or vacated spaces. I understand that there are 2 kindergartens. Well, it's almost time for us to wrap up. Mrs. Yu from the Deputations. You have to conclude in a minute. Can you hear me? I heard Mr. Lam. He mentioned 50 daycare places. He also said that 35 places are for in situ provision. When will that materialize? The government always says that there's no land, but NGOs have identified 40-odd sites many years ago. And now, you've been so quick to find land for CY Leung. For PWDs, you always say that there's no space for residential care. But we identified over 40 sites. You said that none of the sites is feasible. Can you revisit the sites? Well, they have been deserted for many years. So please work harder, and please work as hard as when you serve CY Leung.
Just now I mentioned Tianjin, and there are 50 unmatched places there. We already have a site there. So in the first quarter of next year, we can open that center. As for the other three, they are in situ redevelopment. Then that will be very congested. Mr. Xu, we will follow up on this. I would like to thank the deputations and individuals for attending today's meeting. We understand that there are a lot of demands, and the relevant problems have not been resolved. This joint subcommittee will follow up on many issues, including the aging of PWDs. In many service providers, this is a real problem, and it impacts on manpower, resources, funding levels, etc. I think the SWD has a working group conducting a review on this, and later on we will be discussing that. Just now, many issues were mentioned. We will revisit these issues again. For example, the pilot scheme on home care service for persons with severe disabilities, which will be regularized. So when the government has a more tangible plan, we hope that we can communicate with the deputations again. So we talked about a shortage of manpower, services, and premises. We haven't even talked about quality. So Mr. Tang also mentioned that some of the issues can be referred to other panels for follow-up. So I'd like to thank the deputations for coming today. As for our next meeting, we will be talking about the support and subsidies for carers. Now, the Community Care Fund is considering establishing a subsidy for carers. And we also hope to listen to deputations' views on this. And other than subsidies, supports for carers are also very important. It's not just about money. It's also about services. So we would also like to invite deputations to come share their views with us. Thank you again.